We are back at 8:10 with an incredible medical breakthrough that could someday help many infertile couples. A little girl was born this week in Alabama, and she has her aunt to thank for that. Here's NBC's Kevin Tibbles.
This miracle of life being described as a partnership between God and two sisters. Anna Grace, 7 pounds 15 ounces, was born Monday in Alabama. She's the first baby born after a successful ovary transplant in the United States.
She cried and I cried. Yeah, it was emotional for everybody.
Anna's mother, 25-year-old Stephanie Yarber, became menopausal at 14 and was unable to become pregnant without medical help. Stephanie's identical twin sister, Melanie, donated ovarian tissue to her.
I'm so grateful that it worked.
The transplant carried out by fertility specialist Dr. Sherman Silber of St. Louis in April 2004. A year later, Stephanie is a new mom. Melanie, her twin, already a mother herself, can discover the joys of being an aunt with a special role. Stephanie hopes to one day explain to baby Anna.
I'm going to try the best that I can when she's, I don't understand it, but I've got probably every clipping that she's ever about the surgery. So if I can't explain it, the papers and everything else can. So I've got everything. The only difference now is that, she's a mother and she, we can call each other and talk about our, babies, if they have their cold or whatever. What she means, I can call her when I'm scared to death about something, because I do.
And with the birth of baby Anna, is Stephanie finished? Not likely.
I would like to have 1 or 2 more.
For today, Kevin Tibbles, NBC News, Chicago.
Dr. Braden Richmond delivered Anna Grace, and Dr. Sherman Silber performed the ovarian tissue transplant that made baby Anna possible in the first place. He's the director of the Infertility Center of St. Louis. Good morning to both of you.
Oh, good morning.
Dr. Richmond, let me start with you. Was this sort of a typical delivery, and how are mom and baby doing this morning?
Well, it was typical in many ways, although looming in the back was the significance. Mother did great during her labor and delivery, and she did wonderfully afterward. The baby is just beautiful and healthy.
During the course of her pregnancy, Dr. Richmond, did you have to monitor Stephanie any more than any other pregnant mom?
Well, Katie, we certainly were more aggressive with lab work. Dr. Silber directed us on some blood work to get, and then there were some other infertility things that are maybe a little more basic that we wanted to check to try to reassure ourselves and to reassure Stephanie. We did an ultrasound very early because myself, certainly Stephanie and her husband, Dr. Silber, everybody wanted to see that baby very early. So as soon as we thought we would expect to see a baby with a heartbeat, we did ultrasound. But after that, and after the lab work was reassuring, things calmed down. And she settled into a normal pregnancy like anyone else.
It's very exciting. Meanwhile, Dr. Silber, I know, as Kevin Tibbles mentioned, this is the first baby born after a successful ovary transplant here in the United States. How many ovary transplants have there been?
Well, there really haven't been any successful ovary transplants from one patient to another. There was a case in Europe about a year ago of a woman's frozen tissue being transplanted back to her. A lot of controversy about whether the pregnancy came from her own ovarian tissue before she had cancer chemotherapy or later. So this was really the first case really in the world.
I know that you've performed, though, this transplant on 2 other women. Is that right?
Yes, they're coming out of the woodwork. It's more common than you realize. Once Stephanie and Melanie were the pioneers and people heard about it, what we're discovering is that early menstrual dysfunction and ovarian failure, early menopause, is more common in identical twins than in the general population. So we've already done 3 of these cases, and we expect to do many more.
That's fascinating, and I guess key here was the fact that these girls are identical twins because the risk of rejection was, as a result, pretty low.
Yeah, there really was no risk of rejection at all. And the other aspect of the procedure was that we didn't want to put them through a big, horrendous, you can imagine, a transplant procedure with a microvascular approach and a lot of hospitalization. So we developed a technique that was really minimally invasive, like an outpatient procedure, so it would be relatively simple for them to go through.
What, so it was laparoscopically done?
Well, the donor removal of the ovary was done laparoscopically, and that's easy to do. The actual transplant needed more delicate microsurgery to make sure we really did it right. So we used a little tiny mini lap and just introduced a microscope into it. So technically it wasn't a laparoscopy.